my name is Katie Foster, and I'm the behavioral specialist here at the YMCA. I think that if you have an emergency, that obviously childcare is like one of the number one things to think about, and it makes me feel like my job matters.
Hey guys, it's Mike Diassi, your membership coordinator, coming at you. I think in this time with the pandemic going around, this is exactly what we needed. We're in the community, we're doing our job, they see us as the why. That's all we can really ask for. I love it.
My name is Jawan Smith. I'm a program coordinator. I think emergency child care is very important because I know a lot of our parents are essential workers, so they can't really watch their kids. By us being able to do that for them is like a burden that is being lifted. I think a lot of our kids, I guess, need some social skills. So, by them being at home during this time, that can pretty much deplete that for the most part. By them being here, they're getting those social skills, they're connecting with other kids. I do believe that if we were ever to get inside the building, we would secure it immediately because we are taking the initiative to, stay safe and stay separate from each other.
Hi, my name is Shandy Perez. I am the base program director. You're hearing a lot of stories about how families are being impacted by COVID-19 and kids are scared. It's important to let our staff know and our kids know why we're doing this, the importance of it, and how it's not just about you and me, but because of the way the virus spreads, that we are taking care of ourselves and everybody else. Listen to the state, listen to the CDC. It's difficult to lose somebody who you knew you could have avoided if you took those extra steps. So just know, in the end, this will all just pass over us, but for now, it's just some more health precautions.
Hi, I'm Christina Woznicki, and I'm the Center Director at the YMCA's Child Development Center. I operate the entire building. I make sure we have the right kind of staff to do their job and watch the kids, and I make sure to stay in line with all the rules and requirements. During this time, everything has changed. How I run the childcare program has changed. Me keeping compliance with the government's rules and requirements has changed. Keeping parents' trust in our ability to keep their kids safe is really difficult. We have screenings now. When you first walk in the door, you get your temperature taken and see if you have a fever. And then there's a ton of hand washing. There's hand washing and hand washing and hand washing and some more hand washing. And it's really just keep everybody safe, everybody clean and sanitized. It's really difficult to keep the kids in groups of, 10 or less. They're but the same kids every single day, every single week so far. These kids are often their siblings. They're often completely different ages from them and not people they know at all. And they're doing the same activities. So it's a struggle. In terms of safety, we've always talked about, physical safety. And, that's nice and all, but when we're talking about car crashes and things like that, we've made peace with those things just being a part of life. But we've never had to face a virus that's so invisible and insidious that you don't really know where it is or when it is, kind of thing. And it makes people worry. It makes me worry, and I'm their boss. That being said, I think emergency childcare is vital. We serve so many essential workers in our inner city community in healthcare, but also what I would call supply chain jobs, like in trucking, in grocery stores, in fast food. And those people would not be able to go to work and not be able to make that money if they had to stay home and watch their kids because no one else could. I'm glad. I'm so very glad and grateful that I still have a job when so many people don't. I'm also exhausted. It's a lot to work with. It's a lot of demand, it's a lot of change, and it's a lot of support to give to our staff and our kids to make sure they're feeling comfortable and safe in our current environment.